Hello and welcome, viewers, to another segment of LiveExpertInterviews.tv. My name is Steve Young, and thank you so much for joining us today. Today we're talking about a very important topic, and that topic is how to find a good periodontist. Now, fortunately, joining us from Newport Beach, California is Dr. John Chrispens. Doc, thanks so much for joining us today.
Thank you very much for inviting me, Steve.
Absolutely. It's nice to have you here. Well, look, Doc, really the burning question that everybody has is, with your years of experience, well, first of all, can you just take a minute and explain what is a periodontist? And then, if you would, well, maybe the top 3 things you could recommend to how to find a good periodontist.
Well, a periodontist is a specialist in dentistry who treats diseases of the gums and bone around the teeth. In other words, things like shifting teeth or bleeding gums or recession. That's the main things that we treat. Now, how to find a good periodontist is related to, first of all, if you have an advantage in that you have a friend who's seen a periodontist, that's a good place to start. The second thing I would do is, if you really want to find out a periodontist in your area, go online and look at perio.org, which is the American Academy of website, and it will bring up a window that will allow you to find a periodontist. The third thing is look in your browser and look at the reviews and the recommendations that you see there for periodontists and their experience and their location related to you.
I love that advice, Doc. Obviously, there's nothing better than a word-of-mouth referral. I especially like the part about the reputation in reviews. I mean, it's one thing to say that you're the best at one thing, but it's a whole different ballgame when you have other people saying that you're good at what you do. Isn't that accurate?
Absolutely true.
Absolutely. So, Doc, let me ask you, if somebody was looking for a good periodontist and they came to your office, what could they expect?
I think there would be 3 important things that we really, in our team, work on. That's number 1, the phone call. I think you need to get a good response when you talk to the individual in the office on the telephone. Second thing I think you should expect is a gracious and warm greeting when you come into the office and an atmosphere that you feel comfortable in, and take a tour of the office so you know exactly what's going on. And third, that you get an interview and an opportunity to discuss what your concerns are with the periodontist of your choice.
I like that, Doc. That's fantastic. So, Doc, with all your years of experience, if you would just share with us how your practice is maybe different from some of the others in the local marketplace.
Well, I think the main difference might be in the background and the team that I work with. I did my graduate training in periodontics in immunology and microbiology, which gives me some advantage. I've been a consultant in the diabetic arena and with NASA. We used a laser to treat a lot of things, but I think the bottom line for our whole team is get results. Our treatment is really involved with making a difference on the outside in. In other words, treating the gums and the bone of the person, plus inside out. We really want the person to be medically and nutritionally involved in making themselves better, and the only way to do that is to do it outside in and inside out.
I like that. Now, Doc, I know you mentioned to me you do some special things for new patients. What exactly is it you do for new patients?
I think sometimes patients are really confused as what is a periodontist? Do I have that problem? Might I need to see one? So what we've developed is a game plan. We tell a patient that we'll have them come in for a complimentary exam. In other words, what they'll meet is the team. They'll get a review of the office. They'll get to explain to us what they feel that their challenges are. And then I do an overview oral exam and tell them, yes, you have a periodontal challenge and you should be seen at a perio office, or 2, you don't, and you don't need to come see us even though we might have been really nice people.
I like that, Doc. You know, as I'm getting older in age, my teeth are starting to move a little bit, and I recently went to my dentist, and he told me, look, you've got some bigger gaps in your gums between your teeth and so forth, and they checked me for some type of gum disease, but I mean, it's pretty amazing that it happens. You don't even know it happens, and you need to get checked out. And I'm just wondering how many of the people that you see have a problem that don't know they have a problem.
Well, I would say a large percentage. What's the most difficult thing about being a periodontist is the process is slow moving, and 99% of the time it's painless. I don't see patients on emergencies. They come in wondering maybe suddenly why their teeth look longer, or two, that they've started to shift, as you mentioned, or they notice more bleeding and occasionally maybe even a loose tooth, but it doesn't hurt at all. So the temptation is, don't worry about it. If it ain't broke, don't fix it.
Right, right. And then as far as, once they see you, how fast can they expect to see results as far as their gums tightening up? Like for my case, how long after you have your work done and stuff like that, how fast can you see progress and improvement?
Well, I would say if you have receding gums, you're going to notice a great deal of difference almost immediately, because the procedure itself, the plastic surgery, involved with replacing the gum tissue. So you'll notice it immediately. If you have a loose tooth, you'll notice that it gets tighter. It'll probably take 2 or 3 months. It takes, though, for bone to grow back around the teeth, it does take 6 months to a year, but the patient will notice an instant difference, but you won't notice a difference on an x-ray for a while.
I like it, Doc. That's a lot of information. So there you have it, viewers. Take the doc's advice. If you're looking for a good periodontist, make sure you go online, all right? You look for somebody in your local area. Look for their reputation, their reviews, their qualifications, their experience level, all right, and use the doc's advice. Doc, I want to thank you so much for joining us today.
Thank you very much, Steve, for inviting me. And if anybody needs our help, we're certainly there.
Doc, what's your website?
Our website is drchrispens.com.
It's Dr. Chrispens, correct? Not Dr.
drchrispens.com.
Gotcha. And it's right here on the web on the screen. And then what's your phone number? Your primary phone number?
Primary phone number is 949-833-2263.
There you have it, viewers. If you're anywhere near Newport Beach and you have any periodontist needs, make sure you look up Dr. John Chrispens. Docs, again, thank you so much for joining us. Viewers, we'll see you on another segment of Live Expert Interviews.tv.